What's up YouTube? Sierra here with DIY Dwight, and as you know, if you watched the video before this one, I had surgery on Friday, October 2nd, and so we're going to have a series of videos coming out that are a lot different than what we usually do. If you haven't subscribed to our channel yet, we do a lot of cool DIY Dwight videos, and now we're doing kind of like a DIY, well no, this is not a do-it-yourself hip tear repair, but this is a video series all about this recovery process for FAI and hip labral tear repair.
But first, if you haven't subscribed to the channel already, be sure to do that by clicking the subscribe button below. It lets us know that you like our videos and lets you know when we're posting a new one. Let's check in with Sierra.
Alright YouTube, so it's been about 48 hours since the surgery, so I thought I would just kind of fill you in on my current status, tell you about what the surgery was like, and yeah. So currently I am in bed, and I've learned that the best clothes to wear are basketball shorts. So these are my husband's basketball shorts because you have this brace on, but it also has to attach to the ice machine. So you can't really wear sweatpants or whatever unless you want to put the brace and the ice over that, but you really don't want that much, or at least I don't want that much covering between my skin and the ice, because that is my best friend right now. I'm taking quite a lot of drugs, but the ice really helps with the pain. You can see the ice machine over here, and then the crutches for whenever I need them.
Sierra's also been wearing these wonderful fuzzy socks because you can't do anything and recover at all without fuzzy socks. But also, we have these plasma flow cuffs that go around her calves that help keep the blood flowing correctly so she doesn't get a head rush when she stands up, and prevents blood clots.
And over here is the recumbent bike, and I've ridden that for 5 minutes yesterday and about 10 minutes today. I got almost a full rotation for the whole 5 minutes yesterday, and then I felt a little bit of stinging in the incision site. So today I did 10 minutes of kind of just motioning like this to try to just keep the incision how it was. But I know it sounds crazy to think that you're supposed to get on a bike so soon after surgery, but you really are, and it's totally normal. What else can I share with you? Oh, about the surgery. So I got there at 8 a.m. and they hooked me up to the IV and had me in a gown and all set up and ready to go.
Pre-surgery vibes. Are you ready?
I'm ready. I'm ready for a nap.
Ready for a nap. That's all it is.
It's just a nap.
Yeah. You wake up and you feel refreshed.
Refreshed.
Like a new person.
New person.
Half robot.
There's no metal going in my body.
No, there is not.
Of course, like as a female, I had to pee in a cup so that they could determine that I wasn't pregnant. And then I ended up waiting probably until about 10:30, 10:45 for the anesthesiologist to come in and prep me for the surgery. I fell asleep so quick. I remember going down the hallway and talking to the nurse about something, and then I don't remember that though. And then I went into the OR and they pumped the rest of the anesthesia stuff in me, and I was completely out. My throat hurts quite a bit from being intubated, and my lip is a little swollen from something they must have clipped there, maybe the intubation tube. But apparently the surgery took 3 hours, so it was supposed to only take 2.5, but it was worse than I thought it was going to be. I had both a cam and a pincer bone impingement, and the tear was huge and detached from the bone. So I'll show you guys some pictures of what that looks like in this video. But yeah, so 48 hours. This is the first time I really felt like I could talk and not in as much pain as I was yesterday. And yeah. One more thing I wanted to mention before I pass out is that I start PT tomorrow. I had my surgery on a Friday, and generally you're supposed to start PT the next day, but because it was Friday, they said Monday was perfectly fine. And I went ahead and scheduled it out for 2 months, which is a great tip because they fill up really fast. And one more thing I wanted to say before I go, y'all, is that the pain does suck. It's like a constant 4 out of 10. Keeping my leg in one place, like laying under the covers, is the best. but as soon as I have to move it or get up to go to the bathroom, it is pretty excruciating. And the doctor said that keeping your pain around a 4 out of 10 is like where we need to be right now. So that's how it's supposed to be. So if you're having this surgery and you're experiencing some pain, it's totally normal. And then also I wanted to give a shout out and say thank you to all my friends and family for all the wonderful gifts. My husband has been the best nurse. Mary Beth and Shelby, I freaking love this shirt. I think it's so funny and it's so fitting for me. And the flowers from my friends and the care packages and texts and love, they're really building me up during this new time for me. So thank you. I'll update you guys in another few days with a new video.